Hello, everyone, and welcome to PedChat. Today, I had a chance to interview Dr. Bryan Vartabedian. He's a pediatric gastroenterologist at Baylor and Texas Children's. He has a fascinating story about how his blog, 33 Charts, is becoming a source for thought leadership around medical technology. We talk about how pediatricians can get out of their comfort zone and get their voice heard through two things: persistence and finding role models. Please feel free to leave a comment after you watch the episode so that we can start a conversation and inspire each other.
So welcome to PedChat.
No, it's great to be here. Thank you.
So what did you want to be when you were a kid?
Oh my goodness, you caught me on that one. I wanted to be a weatherman. It was probably because of my limited exposure to things, and seeing the weatherman on the news was sort of kind of exciting. It had some science to it, and so that was kind of my vision. I think I went through a period I wanted to be a vet too. So I wound up a pediatrician. It's kind of the same thing, right? Yeah.
Yeah, exactly. What got you into medicine?
So I went to college with the intent of going to grad school and maybe doing biological sciences, and found I really loved being with people, and spent a summer volunteering at Mass General Hospital. They had a special volunteer program there in the early 90s, and loved the energy and the exposure and the balance of science and working with people, and I thought it would be a good fit for me.
Why a pediatrician?
So I'm actually technically a pediatric gastroenterologist, but I'm a pediatrician first. So I kind of enjoyed the idea of working with people who are generally healthy. I found working with older people with multiple problems was kind of discouraging, and the energy of OB-GYN and pediatrics really drew me. And so I wound up in pediatrics and wound up subspecializing, wanting to do something a little bit more technical. And I wound up in gastroenterology, pediatric gastroenterology.
What made you start writing?
I guess in 2006, I wrote a book on colic in babies. I think I wrote in 2004, 2005, and everyone said, well, if you're an author, you have to have a blog. So I started a blog. And that was kind of the turning point. I guess the mid 2000s, I wrote a post on the merger of Gerber and Nestle, and the post blew up. And I remember I got called by one of the senior executives from Geneva, and I realized at that very moment that this little blog was really a platform to the world. And so what started as sort of a gimmick for promoting a book turned out to be a blog on parenting that kind of changed the way. It was the first time I had communication with the outside world. And then Twitter came along. I think I started in Twitter 2007, 2008. And I was one of the early physicians in Twitter. And as more and more physicians came on board, more and more issues started to come about. Again, this was a while ago, and we didn't know. I mean, doctors coming out to Twitter didn't know, could they respond to a patient who reached out to them? What can they talk about? What can't they talk about? It was really a new time in healthcare, and none of us were trained in any of this. So I started 33 Charts to really help doctors navigate the new social media world specifically. And it evolved as kind of a center of community for doctors as they were coming into this new space.
For those pediatricians out there, or providers in general, but mostly pediatricians will be watching this, what would you tell them if they're interested in starting to do something else entrepreneurial with their life?
Yeah, it's a really interesting question, because physicians are not primed to do that. We're kind of trained to walk in lockstep. We're really, our culture is such that we're very reserved and we're less likely to take risks. And we're kind of trained to do that from our years in college or through medical school. We don't leave the crowd. And so the reason this is a problem is because we're in one of the most disruptive periods in medical history. If you look back the past 300 years, I mean, we're a reflection point on so many levels, and there are so many convergences, artificial intelligence and wearables, and it's almost even hard to process all of it. So this is one of the most amazing times to be in medicine. And so consequently, everybody should be jazzed about it. Yet the dilemma is that you talk to doctors, they're burnt out, they feel like they're not empowered, they're stuck, they're in a rut. And so the question that you pose is a challenging one, because it's really hard to break out of that mindset, but yet there is so much opportunity. I think starting by putting yourself into the public space is probably a really good place to begin. We can connect so easily with every other doctor on the planet, and every other developer on the planet, and entrepreneur, and finding your passion is kind of a core thing too. I mean, what are you really interested in? I think doctors really believe that the only thing they can talk about is health conditions, when in fact there's so many things that they see in their world around them that they can kind of grab onto and build on. So getting out there, connecting with people, networking on sites like Twitter, reading, consuming, thinking, sharing ideas, that's where the magic happens.
Yeah, I think you said something about getting out of your comfort zone. That's what you call it. And I read an article this morning. It was like the rise of, The rise of medicine's creative class or something like that. Is that
absolutely? There is. I mean, we don't see physicians as being creative. I mean, it's kind of, my day is made up of two modes. There's sort of creative mode and there's reactive mode. And most of medicine is reactive. Most of it's algorithmic. We can argue there's creative thinking that happens in the patient encounter, but largely it's algorithmic. And so we're seeing these doctors pop up. Joyce Lee at the University of Michigan, who is an innovator in healthcare design. She's an NIH-funded researcher, but she's part of what I call this creative class in medicine. They're sort of taking off and building and creating and making in places and spaces where doctors were never thought to ever be found. And so I've kind of called it medicine's creative class. It's this group of doctors that are kind of doing and making. Back to the prior point about how to get started. Depending on what you want to do, is if you have an idea for a startup or a gadget or whatever, you want to try to find a role model who's done something similar to you. A physician who maybe is in private practice or in academics, who has taken the step to build a product or build whatever. If you're an academic person and you are interested in design and makerspaces, Bon Ku at Jefferson University would be a person who you could just look at his career and study it, and even talk to him and say, how did you do that? How did you make this step? So finding good examples and good role models is a great place to start with anything. I always tell doctors when they're starting blogging, starting on Twitter, track somebody for a good 2 to 4 weeks, look at what they do and mimic them. So
yeah, reverse engineer their success if they're where you want to be. And then, like you said,
right,
it's very easy to connect with them, and you can potentially have a conversation with them, potentially interview them, right? Like
exactly. Yep. So you have to be willing to sort of step out of that comfort zone, picture yourself doing something a little bit different. And it's not always easy. I work in a large academic center, and it's been challenging along the way, especially early on, talking and writing and speaking on social media and trying to get things initiated at Baylor. It was presented some real challenges because the system wasn't quite ready for doctors to engage with public dialogue. I actually wound up, so I persisted enough. I served for 3 years as the director of digital professionalism for Baylor College of Medicine a few years back when we were first getting into this whole idea of doctors being in public. So if you persist, people kind of buy into your ideas like anything else, I guess, right?
Getting out of your comfort zone, persistence, sounds like what an entrepreneur needs.
Yeah, finding role models.
Let's stick with this topic. What books would you recommend?
I mean, there's one name that comes to mind that sort of made me think a lot, and Seth Godin is obviously 2 books in particular, Linchpin and Poke the Box. Linchpin is just an amazing book for seeing yourself as someone who can really make a difference, especially in a large organization. I think it has real relevance for those in academic medicine who feel like they're misfits on some level. poke the boxes about trying things. And I kind of live and die on one of his core beliefs is called, I think he calls it shipping, which is, getting a product or getting something, a piece of writing, an idea, a concept to a certain point, and then launching it. I guess in tech, what do you call it? The minimum viable product.
Yeah, MVP.
Yeah, MVP. So it's kind of the same thing. And that resonates with me because I'm kind of, if you look at my writing, I'm kind of a perfectionist with language and syntax and everything else. And so sometimes I need that push to say, you got to just get started and put it out there. And that circles back to this whole idea of you getting out of your comfort zone and finding someone and starting something and building something. It's just, I think it's a very important message, and Seth Godin does that very well.
Is there anything else you want to talk about or say to the world?
No, except that just to kind of echo what I said before, this is, I mean, the most amazing time to be in medicine on so many levels. One of the things I love about my blog is I'm able to kind of participate in the whole revolution that's happening. So often I look at these startups and I say, oh, I would love to be the chief medical officer for that startup. And then the next day I see this other thing happening in artificial intelligence and I say, I'd love to be doing that. There's so many things happening that we all should be thrilled to be in medicine, to see so many physicians who are discouraged and stuck and feel like they're victims of their EHR and everything else. It's crazy. We just need the courage to sort of step out and think differently and see ourselves functioning in a slightly different role. And so I would encourage any doctor listening to sort of take the reins and figure out what they can do to sort of be part of this revolution and all this disruption that's happening and make themselves happier along the way.
Doctors are stuck. What does that mean exactly? You said they're complaining about their EHRs, but I feel like there's something more to it.
Yeah, well, I mean, I think it's there are a lot of changes happening in medicine independent of advances in technology. Healthcare, all reimbursement, healthcare economics, encroachment on our profession by advanced practitioners. There's a lot of things changing that could, make doctors a little bit queasy. But with respect to technology, I think there's a tendency to see ourselves as being carried along by the world of technology. This technology is given to us and we kind of have to do it. EHR being the great example. Yet doctors really should have agency. We really should be participating in all of this. And we really have to kind of step up and make ourselves heard and participate at a ground level with how things are changing and evolving, because I think there's a concept called technological determinism, which is that technology just moves forward and we follow along with it. I don't embrace that. I think humans have a greater role in shaping the way technology goes, and physicians have to, going forward, play a bigger role in how their profession evolves. I think our profession is changing very, very quickly. And it's being defined by technology. It's being defined by empowered patients. It's being defined by the information revolution. And doctors are just getting swallowed up and they don't really see themselves as being empowered and part of the process. And so anyway, it's very, very interesting time to be in medicine.
How did you become empowered?
I guess I first became empowered when I realized I have the capacity to sort of reach the world with my voice. Prior to that time, and for several hundred years before, 300 years maybe, the only way that physicians could communicate was through medical journals. And it was all permission-based. You had to bow to the knees of bow to the editor, and if you had permission, if you were given permission, you had a voice. It was freedom of the press by the people who owned the press, right? Seth Godin calls this the tyranny of the picked. We all sit around waiting for someone to pick us to do something. In fact, it's really funny. I've had so many doctors right here at Baylor who have come up to me and said, "How did you get permission to start your blog?" And I said, "I didn't get permission. I just did it." And it's like, "Oh, what's the process?" There's no process, I mean, of course, there's some things we think about. being part of a large enterprise organization that we were careful with and what we talk about, but it's still this idea that it's a tyranny of the picked. And so we see ourselves as sort of under the thumb of everyone around us. And it's a real problem, I think, for our profession.
It's part of the reason why I'm doing this.
Yeah, no, I think it's great. It's great. I think, there's a lot of attention drawn to patients and the e-patients, and that's very, very important. But again, physicians have to step up and be part of the conversation. And, this is my example whenever I talk about the power of public voice. If you look at what happened with vaccines and autism 15 years ago, Andrew Wakefield wrote a fraudulent paper that links the MMR vaccine with autism. And for, the better part of a decade, the public dialogue was hijacked by this voice of this loud minority of anti-vaccine people and conspiracy theorists. And where are the pediatricians during all this? They weren't part of the conversation, and we see what happened. And so whenever a young parent would Google vaccines and autism, they only heard this shrill voice. And so we have a responsibility as physicians to be out there. We have a responsibility to be part of the public dialogue and helping steer the public conversation. This is just purely communication, nothing to do with innovation. But being out there is an absolute minimum. And that's kind of how we start, by connecting and patients seeing us and so on.
I agree it's not innovation, but I think that might be the first step to innovation, though, is getting out there and getting empowered and letting your voice heard. Because as you said earlier, we have this problem with all the smartest innovators and technologists in Silicon Valley bringing stuff into the medical space that really isn't necessary or isn't truly impactful, right?
Right. Stephen Johnson, who wrote Where Good Ideas Come From, another great book where he talks about the stretch of modern history and how certain periods in time, in the cities in Italy and Venice and whatnot, where you had this collection of people getting together and ideas having sex, so to speak, and all these great things happen from people getting together. And it's absolutely amazing when I talk. I do a lot of speaking on public presence and this sort of thing, and physicians, so many of them are just, they're what I call inward facing. Their world consists of their small group of people that they work with in real life and a small network of people they share by communication with nationally. And then beyond that, they don't look or connect. And I'm kind of what I call outward facing. I mean, I'm always looking beyond my personal space out into all, these networks, limited number of networks that I participate in for ideas and for thinking and people. And to hear these people say they really just don't want to participate is just bizarre to me. It's just bizarre. Anyway.
So how can people get in touch with you?
Oh, good question. So go on 33charts.com. There's a contact page there. My Baylor email address will work to bsv@bcm.edu. That's bsv@bcm.edu. I'd love to connect with you some. Oh, Twitter at Dr_V.
Well, thank you for being a part of PedChat. This is interview number 3, and it will be coming out soon.
Oh, excellent. Yeah, let me know, and we'll move it around the web.